Good morning, everyone. Allison Carlson here, ready to chat with you about health, nutrition, chiropractic, exercise. I had somebody ask the question about, we were talking about low back pain. And specifically, this isn't even anybody that's in our area. It was somebody I was chatting with on Facebook. But they were talking to me about an uncommon reason. Well, they went to the chiropractor for low back pain, but they were diagnosed with something else that didn't have anything to do with their low back. So it made me think of, what are some uncommon reasons for low back pain, and why should we pay attention to our low back pain? So I can't tell you how many times it happens where people will come in to the chiropractor and I will say, well, how long have you been having this pain? And it is oftentimes months at a time. It's not like, oh, it just started 2 days ago and I thought I would come in and get it taken care of. A lot of people will have low back pain for months and they are trying to stretch. They are trying to rest. They're trying to ice. They are trying to take ibuprofen or whatever type of anti-inflammatory, and it doesn't go away. So finally, they get into the chiropractor months later. Well, here are some I came up with 4 uncommon reasons for low back pain, and they are all things that we should be paying attention to, and they are all things that I don't want my patients waiting months for. So the first thing is a weak pelvic floor. Your pelvic floor is like a sling at the bottom of your pelvis. Traditionally, a lot of women are aware of this because a lot of women develop a weak pelvic floor after pregnancies. People that are sedentary have a weak pelvic floor. People like after a surgery, if they lay down a lot, because the pelvic floor needs gravity, right? And so when you're pregnant, there's that extra pressure on it, plus that pelvis is opening up. But a weak pelvic floor can cause low back pain. Now, this is why you go to a professional, because a chiropractor needs to differentiate. Is it the pelvic floor? Is it the low back? Is it your pelvis that's causing pain, right? So we need to leave this up to the professionals. The next thing could be low back pain could be coming from kidney stones. I have probably had over my career 5 different patients that came in for low back pain that it was actually kidney stones. And a trained professional will be able to differentiate these things. Kidney stones sometimes are accompanied by fever, maybe kind of like flu-like symptoms, throwing up, blood in the urine, but that's not always the case. It kind of depends on if the kidney stone's moving, the location of things, how much inflammation is in there. But kidney stones can be masked as low back pain. The other thing is uterine fibroids. Uterine fibroids, depending on the size of them, can be putting pressure on other organs in the body in referring to low back pain. And the uterine fibroids tend to be cyclical. And so it comes and goes. So when I have patients that say, well, for a couple of days I have this debilitating low back pain, it could be uterine fibroids. The last thing, number 4, is prostate cancer. Or this patient that I was talking to, they actually had kidney cancer, and it was a chiropractor who found it, okay? They had gone to their primary doctor. The primary doctor had just given them anti-inflammatories, and nothing was helping. They couldn't sleep at night. No matter what position they were in, they still had pain. In this particular patient, they had kidney cancer. Prostate cancer is commonly talked about in how it causes low back pain, because your prostate gets enlarged, it presses on nerves and other organs, and it causes low back pain. So This is why we need to leave our low back pain up to the professionals. Let's make sure that it's just, I say just, low back pain and not being caused by any of these other uncommon reasons. So if you've been experiencing low back pain for a while, if that rest, ice, anti-inflammatories aren't helping, reach out to me. Come into the office. If you're not around here, reach out to me and I'll help you find somebody that will love and take care of you. And we'll make sure that we get to the root of the cause and make sure that you're doing what you need to stay healthy, to stay happy, playing with your kids, playing with your family as long as possible. Thanks, guys. Have a great day.